Now let's talk about the middle meatus, which is very important. So it shows very important structures which are important in endoscopic surgery of the sinuses. Now let's talk about uncinate process. Uncinate process is a hook-like structure which is running from the anterosuperior to posterior-inferior direction. Now let's talk about its boundaries. So the posterior-superior border of the uncinate process is going to be sharp, and it is going to run parallel to the anterior border of the bulla ethmoidalis. And the gap between the two, which means the gap between the uncinate process and the bulla ethmoidalis, is going to be called as hiatus semilunaris, and it is a two-dimensional space of 1 to 2 millimeter width. Now let's talk about the antero-inferior border of the uncinate process. So for that remember AIL. So anterior-inferior border of the uncinate process is attached to the lateral wall. So anterior-inferior border is going to be attached to the lateral wall, and the posterior-inferior end of uncinate process, so remember PII, for that it is going to be attached to the inferior turbinate, which divides the membranous part of the lower middle meatus into anterior and posterior fontanelle. The fontanelle area is devoid of bone and it has membrane only, and it leads into maxillary sinus when perforated. Upper attachment of the uncinate process shows great variation, and it may be inserted into the lateral nasal wall, as you can see here. It can be inserted into the lateral nasal wall, or it can be inserted into the upward into the base of the skull, or into the middle turbinate. So this is going to basically affect the drainage of the frontal sinus. The space which is limited medially by the uncinate process, frontal process of the maxilla, and sometimes the lacrimal gland, and laterally by the lamina papyracea, is called the infundibulum. So it is the space which is limited medially by the lacrimal bone sometimes, and uncinate process, and the frontal process of the maxilla, and laterally by lamina papyracea, is called the infundibulum. The natural ostium of the maxillary sinus is situated in the lower part of the infundibulum. The natural ostium of the maxillary sinus is situated. Accessory ostium or ostia of the maxillary sinus are sometimes seen in the anterior or posterior fontanelle, which were limited by the antero-inferior border of the uncinate process, as we discussed before. Now let's talk about the bulla ethmoidalis. It is an ethmoidal cell which is situated behind the uncinate process. The anterior surface of the bulla will form the posterior boundary of the hiatus semilunaris, as we can see here. And depending on pneumatization, it may be a pneumatized cell or a solid bony prominence, the bulla ethmoidalis. The bulla ethmoidalis may extend superiorly to the base of the skull and posteriorly to fuse with the ground lamella. So it can extend superiorly to the base of the skull and posteriorly to fuse with the ground lamella or the basal lamella. It is called suprabullar, or when there is a space above or behind the bulla ethmoidalis, it is called suprabullar recess or retrobullar recess. The suprabullar and retrobullar recesses will together form the lateral sinus or the sinus lateralis of Grunwald. So with this lateral sinus is formed by these two recesses. The lateral sinus is bounded superiorly by the base of the skull, laterally by the lamina papyracea, medially by the middle turbinate, and inferiorly by the bulla ethmoidalis. Posteriorly, the sinus lateralis may extend up to the basal lamella of the middle turbinate. The cleft-like communication which is present between the bulla and the base of the skull, opening into the middle meatus, is called the hiatus semilunaris superior, in contrast to hiatus semilunaris inferior, which is referred to before.